Welcome everybody to the spring provider briefing session. As it says in its title, this is lots of information that we hope will support you to provide this wonderful EYFS provision that you will provide for us out there, helping us all to meet our statutory duties and meeting the needs of the wonderful children and families that we're privileged enough to work for. We have, as ever, oh, why is that not working? A busy agenda which we will work our way through, and we'll also have several people here, so it won't just be my voice. It's lovely to share it out and to get expertise from across North Somerset. So we have Jill Bennett and Vicky Burt from the funding team. We have myself and Ree Richards, who are going to be doing various bits throughout the session. We have Jane Worrell, our early years public health specialist, and Naomi Greaves, our health improvement specialist from North Somerset. Karen Jarvis. Karen, I don't think Sarah Evans is here as well today, is she? Is it?
No, she isn't
here.
No.
Okay, so Karen Jarvis doing our SEND.
Yeah, she is.
Oh, she is. Karen and Sarah doing our,
is.
sorry, Sarah. Karen and Sarah doing our SEND input, and we also have Sarah Long from our team. So a packed presenter panel, and it's really nice to have everybody here sharing expertise to support us. So we're going to start with funding in a moment, look at the Better Start in Life plan, touch on our health input around nutrition, potty and toilet learning and safer sleep, the SEND agenda and the link programme, recruitment and references, which has been a bit of a hot potato that seems to be coming up at the moment, our annual provision audit that a number of you here were kind enough to complete to support us with targeting our work, looking at supporting refugees and asylum-seeking families. We're just signposting some resources today, but we're going to have a slightly longer session with that in the autumn time, in the autumn term, and I'll speak to you a little bit about that around the annual provision audit, the safeguarding audit, just knowing that that's coming, and a couple of other local updates, and then finishing with CPD updates. So I shall start first of all by handing over to Vicky and Jill. I think it's Jill to start off with around our funding and sufficiency slides. Thanks, Jill.
Thanks, Gail. Morning, everyone. I won't go through all the strategies, but just to let you know that we've got two new strategies that we're working to. School-based nursery strategy, so that's around schools who want to add a preschool or nursery, and will be contacting us for phase 3 of the school-based nurseries, and school age childcare strategy, so that's before and after school and holiday childcare, so that's bringing together things like the HAF programme, the before and after school care, and holiday childcare. Just to let you know that we will only support capital funding for any new school-based nurseries where there's a need or an existing preschool wants to move on to school site. So if I have the next slide, please. So I think these have already been sent out to you separately because yes, obviously they're quite small. So this is the school-based childcare strategy, so the before and after school one. And if you could just go to the next slide, please, Gail. And this one is the school-based nursery strategy. So we are welcoming any comments. These haven't been agreed yet. So if you want to send any comments to us, if you could send them directly to me, I'd be grateful. So that's me done, really, Gail, if I hand over to Vicky.
Okay, thanks, Jill.
Unless there's any questions.
Just to say as well, while you're thinking of any questions, if you have any, is that we did talk about this at the provider reference group as well, and I'm aware I haven't got the provider reference numbers and contact details on these slides, but I'll make sure those are added in before the PowerPoint is available on iLearn for you to download, which it will be shortly after this meeting is finished. So we have talked to your representatives on that group, but as Jill said, if there's any comments about these policies, and as Jill's already said, to reassure you, this is about childcare and education expansion, not about moving everything onto school site and not having our wonderful nurseries, preschools, childminders across North Somerset. It's to have an expanded offer for the expanded childcare and education offer from central government. I can't see, Ria, are you happy to manage chat? Because I can't see that if there's any comments in chat, and if not, we'll move on.
Yeah, I'll do my best. I'm still doing register.
Okay, but there's nothing in there at the moment.
There's nothing, Gail.
Oh, okay, thanks, Jill. Okay, over to Vicky then, please.
It's just a reminder, we are getting quite a lot of parent complaints at the minute, and it's normally because of things that should have come into place for 2026. So a lot of the issues are confusions over the funded hour patterns and the private hour patterns. These are now meant to be put on your websites wherever possible, along with the charging. So any charges associated with funded hours now are voluntary, and you must raise awareness that they are voluntary. It can't be hidden away in your terms and conditions somewhere. It should be right there on your website what the voluntary charges are and how much those charges are. There should also be information on the alternatives to paying. So if somebody doesn't want to pay for an activity, let them know what the alternative is. The same for food, if they can bring in a packed lunch, or if somebody's allowed to come and pick their child up for lunchtime. For 2026, everything should be published on your website. If you don't have your own website, then you can put it on the FIS part of the website. If you're a childminder with 10 or less children, you don't have to publish your charges on a web page. So just so that you know that. A couple of other complaints we've had in are about registration fees. You can charge registration fees for private hours, but you can't charge them on funded hours. And again, invoices are one of the big changes this year. They have to be clear and transparent. There are now some guides in the guidance that I sent out. So there's a gov.uk webpage and there's a gov.uk template that will show up on the next slide or two. Thanks, Gail. So this is the statutory guidance. It's a few bits on the transparency where it will tell you about the charges and the invoices. Again, I've sent an email out with the link to this, so you should all be able to read that yourselves. And this is the example DFE template. So I've just put that there in case you want to have a look. We have taken a look at a couple of different providers' web pages lately. And I have to say some are very, very confusing when you're trying to look at, if I wanted to attend from say 8 a.m. till 6 p.m, we would like to see what funded hours there were, what consumables and things, and it's very, very difficult just to come up with a weekly amount. So it might be a good idea within your settings, if you just got a different member of staff, to have a quick look at your web page and see if they can work out your charging from that. I think that's it. Overclaims. I have done an audit of overclaims recently, and we had about 40 children that did overclaim. Because of the expanded hours, people can overclaim over 100 hours, which is a lot for your setting to get claimed back in one go. The majority of these overclaims are where a child has had stretched funded hours in the summer funding period, and then they're going to change across to term time funding. Now, the main difference for that is if you take the normal 15 hours a week, that would be 195 hours normally for the summer, whereas it's 246 for stretched funding. And then if you put that in expanded hours, that's an even bigger difference. So it's a reminder, really, when you have a child move to you or change from stretched to term time, please do check what funded hours they've had in the child's funded year. And there are 3 points in the year a child has a funded year. It can either be the summer, the autumn and the spring, and that depends on the child's birthday. So it's not a funded year per setting. It's not an academic year for a school. It's not a financial year for a nursery. It depends on the child's date of birth, and the funding year is the 3 funding periods after the child's date of birth. So if the child was born this month, April, their funded year would start in September. I have sent a grid out for everybody this week as well to show you those dates. Thanks, Gail.
Thanks, Vicky. Are there any questions?
Yes.
Either people? Yeah.
Yeah, so Sammy from Nursery on the Green, you've asked about sending a link. Can you just confirm which link you're after and we can make sure that the relevant person sends you that? Sandy from Rainbow Preschool, are settings contacted if there's been an overclaim?
Not sure that I can send the link again that was sent out to settings for if there's an overclaim. I do contact them, but it's after the fact because we always hope that people will check the claims before they place them, because it's against the rules to make an overclaim. So if I find an overclaim, I will email, tell you which child, tell you what they've claimed, tell them why it looks like there's an overclaim and how much, how many hours I'm claiming back.
Okay.
And then another one has come in. Sorry, is it Jill we contact if the information on FYS is wrong? Jill's sorry, replied.
Yeah.
Thank you.
Okay. Emma Rogers got a hand up, I think.
Can we just confirm about the notice period? So we've got some settings that when our children are leaving and going somewhere else, whereas if they're a private pay, we would say they have to give us 2 weeks notice. If they're funded, we can't charge a notice period, can we? Is that correct?
The funding can't be used for the notice period if the child's not there. What we recommend is you take a deposit that you can, so it's a refundable deposit for funded hours. However, if they breach the contract for any reason, you can keep that deposit. So we recommend taking a deposit in case somebody just does up and leave, because unfortunately the funding does follow the child.
We have another query from Rainbow Montessori. Do we need to use the template for extra charges, or can they be listed in a different way on website and invoices?
They can be listed in a different way on the website. If you have a look at the statutory guidance, it does say that the invoices need to be broken down into certain sections. So from memory, that's private hours, funded hours, consumables, activities and food.
Good memory, Vicky.
Thank you.
Any other questions?
Another one from Bobby. Are we allowed to charge a deposit for children who are only on funded hours?
Yes, as long as it's a refundable deposit. So if they breach their contract, you can keep that deposit. You can't charge a registration fee for funded only hours, but you can charge a refundable deposit.
Lovely. Any more while we've got Vicky with us? No?
Nothing else
No.
there.
Okay. Thanks, Vicky and Jill. If you think of anything else while we're going on, of course, keep popping that in chat, because sometimes things take a while to filter, don't they? You think, oh, I wish I'd asked that question, Zane. So moving on to our Best Start in Life plan. So you know that we had an early years strategy, which ran from 23 to 26. So that will be coming to an end in July, and it's going seamlessly into the Best Start in Life strategy. But this is something that has come from central government. It's something that we had to have in law, and we had to have it published by the end of March. It's worked along the same principles in that it's very much a partnership model, working alongside the Best Start Family Hub model that we're having, that again is being strengthened across North Somerset. We were a kind of step ahead of that because we didn't lose our children's centres, but the family hubs are are strengthening, growing, and will be a huge partner in this Best Start in Life, which is to improve life outcomes for all children, particularly our disadvantaged children. So we're not going to dwell on the detail of this today, but the link is there. I will just briefly go about an outline of the Best Start in Life. So it's split down into our approach, which is our vision for our young children, our case for action, which I'll go into a little more detail, which is up on the screen at the moment, and then system enablers. And our vision for children and babies is that they will all be safe, healthy, happy, learning and engaged, and for adults that they will support children in staying safe, in good health, well-being, early learning, equity and fairness, and that we will be supporting those trusted adults. The case for action part is the bit that obviously we will be working on as part of our work with you and with health, and strengthening the 2 to 2.5 year review and nurturing early communication, child level outcome focused priorities. We know we've got a huge push, well, everybody has a push on their good level of development, particularly for those children in receipt of free school meals who are EYPP children, how we can support them to have better assessment outcomes at the end of the foundation stage profile, at the end of reception. So a lot of work that we'll be doing will be tying directly into that, and there'll be various bits of work that will be coming out that will come through both provider briefings, newsletters, etc., that we'll be asking for your support in as a collective model to support these outcomes. Strong foundations for children's best start in life, home learning environment and parenting interventions. So it's of course partly our parental partnerships under our EYFS commitments, but also how we work with family hubs with their parenting programmes and how we're making sure that we're saying the same messages. High quality early education and childcare, transition to school in the reception year. And again, one of the things that came up through the provider reference group is also supported transitions into nursery, talking particularly around breastfeeding mums and making sure that we are really getting those messages across. And for the provider reference group, we also want to know that this is being picked up directly by Dan Aldridge, our local MP. Tracy Wells has managed from being our provider reference group and hearing the concerns about babies arriving and parents being ill prepared for that transition into nursery. That's been taken really seriously because of the importance of those attachments and trying to make it as trauma-free as possible, that transition. So a transition to school reception year and nursery, special educational needs and disability support, maternal and early years health services. And as I say, some of the detail of that, although this plan is up and published, we will be doing the detail of the operational plan and how we can, ask for your work to be tying into that as we move through the next couple of years, because this is a 2-year plan from 2026 to 2028. So as part of that, we obviously work very closely with our health colleagues. So I'm really pleased to welcome Naomi Greaves, as I said before, our health improvement specialist. He's going to be talking us through some of the nutrition guidance and how that impacts on our work. Thank you, Naomi. Welcome.
Perfect. Thanks, Gail. Thanks for having me, everyone. I just want to do a quick introduction for those of you who don't know me. So my name's Naomi. I'm a health improvement specialist for food, nutrition and workplace health. I work with early years settings to support healthy food provision, positive eating behaviours and staff wellbeing as well. So I can offer things like practical evidence-based guidance to help you looking at providing healthy balanced food and drink for your children, encouraging positive food behaviours and relationships with food, supporting you to understand and meet the relevant nutrition guidance and standards, which I'll be talking a little bit about today. And also to promote health and well-being across your whole setting, including your staff as well. Next slide, please, Gail. So as I said, I'm just going to talk a little bit about the EYFS nutrition guidance. This is a particular section that Gail said has been sort of bringing up some discussion. But if you want further support on this, please do get in touch. If I don't have the answers, I will endeavour to find out. So in terms of food brought in from home, what does this mean in practice? So in the guidance states that providers are responsible for ensuring children receive healthy, balanced and nutritious food. This responsibility still applies when food is brought in from home. So what that means is that providers should have a clear food and nutrition policy, and they need to communicate that the expectations to parents, and that any food brought in from home should align with the healthy options offered by the setting. And that's making sure that children are getting these consistent messages about nutrition. Next slide, please. So what it doesn't mean, so you don't need to be inspecting or policing every lunchbox for the nutritional quality. And you don't have to refuse entry to children with less healthy food. And also you don't need to provide refrigeration or reheat food brought in from home. The guidance is about encouragement, consistency and communication. So it should be supporting parents and that, things are not going to be right all of the time. So it's about what you're doing to support parents in that. Next slide, please. So what does that mean for you in day-to-day practice? So having a clear policy on food brought in from home, that should include packed lunches and snacks. It needs to explain why healthy and balanced food matters. You need to clearly outline what's encouraged and what's discouraged, and this policy should be shared with your parents. So it could be things like, we encourage packed lunches to reflect our meals in the setting, which include fruit, vegetables, starchy food, and we discourage sugary drinks, sweets and crisps. So it doesn't have to be that they're bringing in exactly the same food that's on your menu, but it needs to be a healthy, balanced meal coming in. Next slide, please. Also, healthy food should be encouraged, not enforced. It's about supporting parents, encouraging healthy choices over time, and supporting parents to understand the guidance. We don't want to put barriers in place and make parents feel, you know, discouraged, or that they're finding it really hard to do this, because we know some parents are going to find it tricky to begin with. So we need to be thinking about the consistent messages to children about food. And the guidance also recognises that families may bring in food for medical, cultural or religious reasons, but also not all parents will follow the guidance immediately. So it can be tricky to engage those families. So what it's about supporting you to work with the families to encourage these changes over time and making sure that that's in place. So some practical examples might be sharing a packed lunch leaflet. Some parents might find it, they might not know what a healthy packed lunch looks like, or it might be that they're struggling to come up with ideas for a healthy packed lunch. There's lots of reasons why it can be tricky, and I'll talk about some training that I've sort of made which will support you in that. You could provide menu examples similar to the food you provide, and things like promoting those everyday foods rather than occasional foods. So a little bit of learning around that, what a healthy diet sort of looks like, can be really helpful. Next slide, please. So also in terms of consistency for children, so food, again, food that's brought in from home should align with the setting's healthy eating offer, and that makes sure that children are getting those consistent messages, and it supports positive food behaviours and it reduces confusion. So some practical examples, and I'm sure many of you already do this, but as a setting, if you're only offering water and milk and discouraging fizzy drinks and juice, that's what we need to relay to our parents as well. So that sort of shouldn't be coming in. And also things like sweets and cakes, they're not part of everyday food, so we need to discourage them in packed lunches as well. Next slide, please. So in terms of, if you have any questions, I know it's a real whistle-stop tour, and I know the guidance is vast, so I can't cover all of it today. But if you do have any specific questions about the guidance, please get in touch, or about anything else food nutrition. I'm just looking at the chat. Claire, where can you get the packed lunch leaflet? If you pop me an email, I can send you one over. I'm also just going to quickly talk about some training, and there's a link for this as well. So if you could go to the next slide, Gail. So I have created a package of training. We've called it the Better Health Bite-Sized Food and Nutrition for Early Years. We know that healthy eating is really vital for growth, development and lifelong habits. It supports physical health, learning and emotional well-being, and it aligns with the early years foundation stage requirements as well. But it's really important. Food and nutrition is so important, and getting those habits at a young age is vital for sort of moving forward with healthy food habits. Next slide, please. So in terms of the training package, it was developed to help the early years providers on the Healthy Early Years programme to promote healthy eating, but it is open to all. It's practical, evidence-based guidance for everyday practice, designed for practitioners, managers, childminders, or anyone that's sort of interested in food and nutrition for young people. It supports compliance with the EYFS and local health priorities, and has a positive impact on children's health and well-being. Next slide, please. So, or you might have to click through these. I've got animations. There are 5 modules at the moment, but if there are other areas that you would like to see training on, please let me know. We can develop more. This was sort of based on feedback that we had from providers. There are 5 modules. They take between sort of 15 minutes to 30 minutes, depending on which size. So I've tried to keep them quite short. I know your time is precious. They are now on iLearn, which is really great. So you can dip in and out of them. You don't have to complete it in one go. They've got a mixture of sort of videos and quiz questions and those sorts of things. And the topics that we're covering, we've got one on healthy lunch boxes, we've got one on pre-packaged foods, and that sort of covers the ultra-processed foods as well. We've got food provision in earlier settings. So that one covers the EYFS nutrition guidance. That one's slightly longer. I think that's the longest one. We've got a session on a compassionate approach to food and nutrition, and that's understanding weight stigma and unconscious bias, and also about the language that we use with children around food. And the final one is food and nutrition education. That's quite a short one, but it's practical examples of how you can incorporate food and nutrition into sort of learning and teaching, essentially. There's lots of helpful resources on there. Next slide, I think is there another slide? Oh, there is, perfect. So in terms of how to access this, if you've got a North Somerset Council email address, they're all on iLearn, you can access it through there. If you don't have a North Somerset email address, it is now available to external users as well. I've popped a link on the slide there that will take you to our iLearn Together. You just need to register for a free account. And then once you're in there, if you search for the Better Health Bite Size, then it will come up with the 5 training sessions there. But again, if you've got any questions or you're struggling to find the iLearn, just pop me an email. I'll hang around for a few minutes if there's any questions in the chat. I know we're sort of quite pressed for time, but again, please reach out if you need support, if you need some support developing a policy, or you want me to come to the setting and sort of have a look at stuff. I'm more than willing to do that. I can support you in any way that you need to around food and nutrition.
Lovely, thank you, Naomi.
I just popped a note in chat, but the good news is, Naomi, that everybody that's here today has booked via iLearn anyway. So they're all familiar with the system, and we use it all the time. So everyone here has booked. And I just put a note that I know Naomi said about actually searching by the title, but also all of those courses are in the early years learning catalogue on iLearn. So I know you're familiar with that catalogue because that's where we've got all of our child protection training and these briefings and everything. But just so some people miss things when they're looking at those catalogues, make sure you click on the title of the catalogue to open up the full offer. Otherwise it can miss things. Thank you.
Lovely. Nothing else come up in chat?
No.
Any hands up? No. Okay, lovely. Thank you, Naomi.
And continue. Sorry, there wasn't. Did we pick up where can we get a packed lunch leaflet? You did answer that, did you, Naomi? Sorry.
Yes, I did. What I might try and do, if I can find it quickly, I'll pop it in the chat. But if not, so we have a range of resources on the Better Health North Somerset website. So I'll pop a link in the chat for that as well.
Lovely. Thanks, Naomi. And continue on our health theme, I welcome Jane Worrell, our early years public health specialist, who's going to be talking to us about some ERIC training around potty and toilet learning and why we feel this is necessary locally. Welcome, Jane.
Thanks, Gail. Morning, everybody. Thanks so much for having me here today. So I'm just going to give you a couple of minutes around ERIC training and why, as Gail said, we're looking at sort of pushing and promoting it locally. My contact details are on the slide, so if you do have any questions after the session, then please get in touch. Next slide, please, Gail. Okay, so why am I here today? To chat to you about toilet training. There has been some government guidance that came out very recently in the last week or so, and it's around sort of school readiness, thinking about how can we get children to be ready for school, thinking about the independence, tying their shoelaces, holding a pencil, things like that, all those great things that you support in settings already. But one of the things which I've picked out is also around encouraging children to use the toilet independently where possible. And then also to sort of support this guidance that came out, there was a recent report from Kindred Squared, and I've just put some of the key highlights from that report, and I've dropped the links on the slides as well if you want to kind of have a little read later. But just to say, sort of, so nationally, 26% of children are not toilet trained when they start reception. So 26%. That's obviously the national average. There will be variances. I think as you go further north up towards sort of Sheffield and places like that, it kind of creeps into sort of 35 or whatever. But what that actually means, if you think an average school day is 6 hours,
1.4 hours of each school day. So 1.4 hours, so nearly 1.5 hours of every school day, certainly kind of reception in year one, is spent supporting children with, you know, changing their pants if they've had an accident, using the toilet and things like that. And that obviously has a massive impact on their child's that child's education, but also the rest of the class. If you've got 30 children and the teacher or the assistant is having to support, regularly having to break and stop and disrupt those lessons, how that can really have a massive impact on that child's learning. So that's obviously what's going on nationally, what the data is telling us nationally. Obviously, we like to think of what's happening locally. So the public health team and the early years team did a little bit of fact finding to find out if there was a need. We've obviously had lots of anecdotal feedback about what happens across the sector, feedback from schools as part of the Healthy Schools programme, but also what we as, you know, working alongside early years practitioners, what information and feedback we get back from you guys as well. Next slide, please, Dale. Thank you. So yeah, so we did this kind of rather simple survey in the winter term, like I said, approaching the primary schools across North Somerset. We had 62 schools respond. So not everybody, but it kind of gave us a good idea of what was happening locally. You know, is this just a national thing, or actually have we got children turning up at school, starting school on that first day in nappies or not being able to use the toilet independently? And what we found was that 1 in 25 children weren't able to use the toilet independently, or were out of nappies, or having frequent accidents, or were still actually in nappies. So 1 in 25 children. Obviously, that just gives us a flavour of it's maybe not a world scale problem. However, we like to take a very kind of proactive approach. We don't want to leave it until those figures get higher. And obviously, there has been fluctuations. We know sort of anecdotally that during COVID times, those COVID babies, that when they were coming into kind of starting the school, how their independence levels were much lower than historically they had been. Next slide, please, Gail. Thank you. So yeah, so we've talked about what's happening nationally. We've talked about a little bit, we've had a little bit of exploration about what's going on locally. And this, as a side said, we want to be really proactive, not reactive. We've got some great figures. There are children that are independent, but there obviously are still some children that aren't independent. And we have decided that it's really important that we look at upstream. So let's see if we can work with those families and those children before they start school. So what's happening kind of in those early years settings, and that's where you guys are where we come to you guys, and that's why I'm here at this session. How can we be proactive instead of reacting? And we're obviously working with Eric. I'm hopeful that all of you have heard about Eric. If you haven't heard of Eric before, you absolutely will do by the time June comes around, because I'm plugging the webinar that's going to be in June at the end of my little slot. But yeah, Eric has some great resources. They have a program called Let's Go Potty. And for them, it's not about pushing blame on parents. There's been lots of feedback when I spoke to early years practitioners about being inconsistency, about the child being at the setting Monday to Wednesday, you guys supporting them, then not being in nappies. And then when they're back home Thursday to Friday and over the weekend, they're back in nappies again. And for that child, that must be really confusing. You know, am I wearing a nappy? Am I not wearing a nappy? All of those things. So it's not about pushing blame. It's around thinking about what are those messages, and parents thinking that it's the setting's responsibility. So what we're kind of encouraging and supporting you with is making sure you've got the knowledge and confidence to have those conversations with parents, explain the importance of starting early, that we don't want to wait until the last 6 weeks in July before they start school in September, having that big panic to try and get the child out of nappies and get them toilet trained. It's around having messages early. It's around having consistent messages. And also our colleagues in Serona, so the health visitors, those children's nurses, they have all undertaken that ERIC training. So what we're encouraging is for earlier settings to participate in this ERIC training program as well. So we all have the same consistent messaging to parents. As part of the public health team, I will be supporting you. We're going to have a page on our website all around with the resources that parents can access. I've put a little snippet on there. So there's weed checkers, there's reward charts, there's prompt cards. So if a child needs additional support, there's the resources that you can create with for that as well. Next slide, please, Gail. And obviously, like I said, so they've got this Let's Go Potty training course. It's self-directed, so it's not kind of time sensitive. You can do it in your own time. You can pick and start and choose when to do it that fits in with your capacity. We've had some feedback already from an early years practitioner, and they're talking about it giving them confidence. They're talking about getting additional resources that they can share with their families. It's about refreshing their knowledge. It's also giving them key insights. And the Let's Go Potty training is all around preparation. So like I said, not wait until that July and you've got 6 weeks to try and get it done. It's thinking about practicing it early. So getting that child used to being sat on a potty, even if they don't use it, encouraging them to sit on a potty and know what it's for. And also about, giving them confidence, consistency, like I said, around messaging that if you committed to it, that you commit to it at home, you commit to it at the nursery, childmind, whoever they're with, but also they commit to it when they go to grandparents and things like that. Final slide, please, Gail. So as I said, there's going to be a webinar in June that will give you a taste a little bit more about what that ERIC training involves, the resources, why it's important, and how we can support families. And Ray, I see, has just put the link in there. Thank you very much for having me today. And like I said, if you've got any questions, please get in touch, and you will see that there will be more information being pushed out across the sector around supporting families to be toilet independent. Thanks, Gail.
Lovely. Thank you, Jane. And all of the early years team are undertaking the training as well, just because, although you feel like something that we know about, but actually there are new messages in there, new thinking around potty learning and toilet learning, some really practical examples of how you can be supporting this perhaps more effectively across settings. So we are really encouraging everybody, even if you're a really experienced practitioner, to attend that free session in June, or perhaps if you're keen to get started earlier, you can look on online, but that would be self-funding to look at the modules that we're undertaking. So that consistency of message across through parenting groups, through Best Start Family Hub, through Serona, through all of our partners, as Jane has said, is going to be absolutely key for this. So please do look out for that and book yourselves on. The last little part, so thank you, Jane and Naomi. The last little bit of the health input is around the safer sleep requirements, which you will all be aware of. It's going to be added to the EYFS network from September. But the Early Education Minister has announced that changes will be introduced this year to clarify safeguarding range requirements. And although it's going to be statutory from September, in the EYFS from September, we're being urged to follow it as from now. And the announcements are as a result of the government's review of proposals raised through the campaign for Gigi, who sadly died through to inappropriate sleep provision at her nursery in 2022. So they're updating the wording on the EYFS statutory framework, which links to the NHS Safer Sleep Guidance. And as I said, it's confirmed that the framework will now be updated so the requirements around safer sleep are set out directly within the EYFS itself. A letter sent to all registered early years providers, which you should have received, confirmed that while these changes are expected to come in from September, providers must already be compliant with them now. And I know from calls that we've been taking that there is some unrest about that. So please do let us know if you've got specific anxieties around this, around providing what you need to. I'm sure you've already seen it, but again, these slides will be available straight away if you want them in a sort of succinct version to be sharing with your team. But the updated wording, developed for children under 2 with input from the Lullaby Trust, medical experts and Ofsted, is as follows. I won't read all of those out to you, but we'll give you a minute to look down if you haven't seen them already. One of the ones that has caused some angst has been the final bullet point, which is about children always within sight and hearing of staff when sleeping. I know some people are grappling with from the conversations we've had. But I wonder if there's anybody else who's read this, who's already made adaptations, or if there's anything that they're concerned about that they're either happy to unmute themselves about or to pop into chat, because this is one of the things we are feeding back to our colleagues in
Gail?
DFE about. Yes.
There's been a question from Rainbow Montessori. Is there a free safe sleeping course available? I haven't come across anything yet because this is so new, isn't it? We'd be waiting, I think, for a course to be developed around this new documentation and the new requirements, but I might be wrong. Have you seen anything, Gail?
No, I haven't. At the moment. It's just being directed to the Lullaby Trust, and there's a link to that on another slide. But of course, if you feel that would be useful to have something expanded more fully, I'm sure we can work with our colleagues from health to put something together for you. And if something comes centrally, obviously we'll send out links to those. Emma or Lucy, I know you've got a hand up.
We've made sure that all our staff have read the reduce the risk of sudden infant death. There's a hyperlink in the statutory framework anyway on the NHS
Yes.
page, which isn't necessarily training, but it does tell you a lot of what you need to know.
Lovely. I believe we've got that link in, Lucy, in a minute. So fantastic. Thank you. I think we have Maggie as well. Did you have your hand up, Maggie?
Yeah, I can't read it in this slide, but some of the slides we've read have got the information about comforters and no comforters under 12 months old, which I don't know if other people have read that anywhere. A lot of ours, when they start about 9 months, still have those little taggy blanket things. And we're thinking you wouldn't introduce that at 12 months, but if they come at 9 months with it, settling to sleep is quite difficult. Has anybody else encountered that?
It was the same question I was going to ask. We've been here at Mendic House, we've been back and forth on what that looks like and means. How do we tell a parent if they've already kind of put a like you say, a little bunny or something that's, you know, their comforter? How do you say, oh, by the way, now you can't have it?
Yeah. Needs to go against all the kind of transition and the familiarity from home, etc., doesn't it?
Yeah. So we're kind of still umming, ahhing and how we do that.
Yeah. Well, we'll grapple with that collectively then. So anything that we find out about that, if there's any sort of, if it's already an established toy, whether there are safety measures around that. So we've
kind of for the moment said that we would let them, if we've got, all our babies, we've only got one currently that's actually under 12 months, but she has a Muslim that she likes to hold on to, and she has a little bunny. For example, yesterday we put her down, we followed everything that we do, which we did anyway, kind of put her in, we let her have it, and when she fell asleep we took it out.
Yeah
So that she's not left alone in with the bed with it.
There you are. Yeah,
that's sort of where we've got to at this current moment in time. As well. Yeah,
that sounds like very sensible management to me. But as I say, that if you're concerned about it, other people will be as well. So any other advice we hear about, or any other methods, but it sounds to me like you've already worked out a brilliant way of tackling that. So is that the link, Lucy? Oh, sorry. Yes. Sorry, I can't.
So I was just going to say, Jane has posted that Lullaby do a safe sleep a week. Great to get behind, great video, and also a leaflet that can be shared with parents around caring for your baby at night, which is quite good for that, working with parents as well. And then Lullaby also does great info on what should and shouldn't be in the cot. There we go.
Lovely, thank you. And this is one that I think Lucy said all the staff have read, because it says providers must ensure that all staff read the NH advice on the sudden infant death syndrome. The Lullaby Trust link is there, and a link to a poster as well that you can put up in sleep rooms, just as that kind of little visual reminder. So we'll continue to, as this embeds further, we'll continue to have these discussions about how people are managing this.
And Claire's got a hand up.
Claire, yes.
Hello, it's Michelle actually with Claire.
Oh, Michelle.
Hi, Gail.
Hi.
So obviously we've read the new guidance that's come out, and I felt like we needed a really tight, clear policy on that. So we obviously already have our procedures, and we're just typing it up now into the policy. Is there anything? And I've just looked at online at the Lullaby Trust. Obviously, for that, is there anything extra you think that needed to be included in a policy? And then obviously we'll share that with staff who are already doing the procedures, but just to make it super tight and super clear around the new guidance. Is there anything else you think we should include in that?
No, I think you've got all of the, you're using all of the resources to inform that. Michelle, I did have had a conversation about you with Sarah McGurn yesterday around that. So again,
Yeah,
if you want us to come in and have a look, as people are developing policies, we could be looking over them and seeing if there are any omissions from our perspective as we're all learning, this together. So, but no, from what you've said, you're citing all of the guidance that's there currently.
Okay, thank you.
All right, Michelle. Any other questions on this one?
Nothing else in chat, Gail.
Okay, thank you. So I'll pass over to Karen and Sarah to do the send and link.
Yeah, so morning, I think Sarah's going to do the first slide.
Okay, morning everyone. First of all, a very big thank you to all those that came to the pre-inclusion link online meeting. We had a great turnout. So thank you very much for that. The inclusion link application form is now live. So the links on this page will take you through to our website page, and on there you will find the online application form. If you complete that and then send it in to the ey.sen, submit it in. And then once you've submitted it, you can go ahead and book your inclusion link program meeting. During that meeting, you will need to have a laptop or electronic device so that you can complete the online transition plan during that meeting. Okay. And then when you get to the review page, the idea is you then print off that page and give it to parents, school, and keep one for yourself, and then submit the plan there and then. That streamlines the process and speeds it up so that as soon as it comes into the ey.sen box, we will then notify funding teams, and then your funding and payments can be made smoother and quicker. It will save you all that uploading of documentation. So closing dates for referrals is Friday the 26th of June. Closing dates for transition plans is the 17th of July. There is going to be an online feedback form which is in the process of being finalised, and as soon as that is up on the website page, you'll be notified via the newsletter. Thank you. Thank you, Gail. Okay, 3rd of June 26, we've got visual prompts training. As you're all aware, visual prompts are a universal strategy, a universal provision that should be used in all of your settings with all children. It's referenced not only in the graduated response profile of need in early years, but also in the getting ready for reception, supporting effective transition. And it is a transition tool. It could be the commonality between your provision and the child's new setting. So we're hoping to have some guest speakers at our next workshop. So please do go on to iLearn, book on, and come and join us for that session. Thank you, Gail.
Thanks, Sarah.
Thanks, Sarah. So other support opportunities, we've got our early years advisor surgeries. So if you want to book on a place at the early years advisor surgery, you need to email us on ey.send.gov.uk, and we can contact you back and arrange a slot. So those sessions, you can have no names consultations if you haven't yet got consent, or can, if you have got consent, you can name, but it's that sort of first opportunity for support and discussion with the team. So that's one support opportunity. We have our next Senko network meeting, which we're going to be holding at Yo Valley Best Start in Life Family Hub. And that's on the 13th of May, so a couple of weeks' time. And that's an evening between 6:30 and 8:30. Those are drop-in sessions, so there's no need to book. Please do join us for those. Thanks, Gail. And so we're really excited to share that we're going to be working in partnership with Dingley's Promise Training over the coming year. to offer you a fully funded programme of accredited training. And that's available to all educators in North Somerset early years or EYFS provision. And that includes reception classes, includes childminders, childminding assistants. And having met with the wonderful James from Dingley's promise this week, it's also something which other professionals working within or working across North Somerset can also access. So, you know, our health visiting colleagues, our North Somerset parent carer forums. So we're going to be holding an online event on Thursday, the 11th of June. That's going to be live on iLearn, hopefully next week. And James will be able to talk you through Dingley's Promise, what they do, and also share the information about the training modules, which are available to you free of charge, and also their mark of achievement. Thanks, Gal. And then I'm sure you're all aware, exciting times. We have at the moment the biggest and widest review of special educational needs and disabilities provision. So SEND reform in early years. So entitled Putting Children and Young People First. I mean, I say in early years, it's across all age ranges. The SEND consultation, so it's open now and it closes on the 18th of May. And it outlines a series of proposals which the DFE are seeking our views on. So they're really keen to hear from all stakeholders. So we urge you, if you haven't already responded, please do take the time to have your say, to respond to the consultation. It builds on the government's plans to improve outcomes for all children and young people, so all children, including those with SEND. So those plans that they've set out in Giving Every Child Best Start in Life strategy, which was published last July, and also builds on the school's white paper, which was published in February 2026, so Every Child Achieving and Thriving. Gail, if you move on to not the next slide, but the slide after that. So we have included the slides from an engagement event which colleagues attended. And they will give you a really good overview of the changes that are being proposed through an early years lens. So, you know, please do take time to read those. But just to give you a brief summary of what is going to be changing or what's likely to be changing, there's going to be a more universal offer. So providing high quality support to children with SEND, and the hope is that that will be earlier and locally. So that sort of real early intervention, that real high quality sort of universal teaching. There are going to be flexible layers of support, and so a sort of a universal, targeted plus and specialist levels are being discussed, and what that might look like. There'll be the introduction of a digital individual support plan for children with individual needs, additional needs, and those are going to be developed in partnership with parents and carers. The reform talks about specialist provision packets for children with complex needs, which will set out exactly what interventions, resources and standards are required for each child at that specialist level. There's talk of a fast track for specialist provision packages and education healthcare plans for children under 5 with complex needs. So that's really pertinent to our work. An updated code of practice. So within that, there's talk of revised areas of need. So moving away from the current broad areas of need that we have to 5 areas of need with a slightly different focus. And there are going to be national inclusion standards. So looking at sort of consistent evidence-based understanding of best practice and what really makes a difference to all children with SEND. And then in terms of what else is coming, so again referenced in the reform and being asked, you know, views on through consultation, is the experts, so expert advice, access to expert advice for mainstream settings, with a talk of an experts at hand offer, with the hope that there'll be more speech and language therapy, occupational therapy and educational psychology support for for mainstream settings, a new early years inclusion training, so a national training package, a new inclusive mainstream fund for early years, and then a wider consultation on reform to simplifying early years SEND funding streams. So looking at those Disability Access Fund and the what we call our top-up funding, looking at sort of wider reform to simplify those processes. And again, the other thing that absolutely is coming is strengthening that SEND offer in the Best Start in Life family hubs. So Gail, if you go on to the sort of flick through to the last slide, so I say there's some more detail there for you from that engagement event. But in terms of responding to the consultation, you know, please do engage with it. It's our opportunity to really shape what early years SEND support looks like for our youngest children, and ensure that our children's needs are met sooner, quicker and more effectively. Like I say, consultation closes midnight on the 18th of May 2026. And that's it, Gail, thank you.
Thanks, Karen. Just to say we're likely to overrun a little bit. If anybody has to leave, we are recording this, so we'll make this if you need to, you know, because obviously your time is very tight. If you can stay, we'll try not to overrun too much, but we've just got a few slides left, and I'm conscious we're coming up to 10:30. So if you do need to leave, we understand, but if you can stay, that's wonderful. I'm going to pass over to Ree. Thank you, Karen and Sarah, to just talk through some recruitment reference challenges that have been coming our way recently.
It's just a couple of slides really. Gail asked me to have a look because some queries have come through to us around quality of references coming through and a lack of information that's useful. So I did a little bit of sort of research and reading around it. I do put the caveat on this that I'm not an HR expert and I'm not an employment law expert. So this is just very basic stuff that I've been able to find from different sort of reliable sources just to kind of support you. There are certainly no legal requirements about what references must contain, but as a prospective employer, you can ask for specific information in a reference. So you might not get that information back, but you can ask for it. This is where we would perhaps say you could think about sending the DFE employer reference template, which I'll talk about in a second, as your request. Please, can you complete this for the reference? As I say, they might have a policy that they have a set form that they use, or only very, very basic details. So they may not return it, but you do have that right to ask. Prospective employers, just a note that you need to make sure that you're checking that the reference has come from a person with the right level of authority in the previous place of employment, which is unlikely in a lot of cases to be a line manager. It's going to be someone more senior of position. If you're not using the DFE form, good practice as a minimum would be for you to confirm the job role, the place of employment, the dates that they were employed, and also basic information about the suitability to work with children from a safeguarding perspective in particular. But we would suggest as best practice that people start using the DFE employer reference template, which is on the next slide. And I know you can't read that, but I've just put it there so you can see sort of how short it is. Gail, if you want to go on to the next one as well. So it's 3.5 A4 sides. The link is there, so you'll have that when you get the PowerPoints from iLearn. And the kind of things it covers, it's basic employment details, what the reason for leaving the position was, would you re-employ them, and if no, why? Are you aware of any allegations or concerns relating to safeguarding? Are you aware of anything around safeguarding conduct, and further information that may help in assessing candidates' suitability? So it does flesh it out a bit and ask a bit more specific questions. If you do send that over, as I say, there's no guarantees they will complete it. They are completely within their legal right to just provide you with very basic information, and I know that is common policy for a lot of organisations. So I've just shared with you sort of what some of the good practice looks like. Thank you, Gail.
Thanks, Ray.
Oh yes, sorry. Just those two, a little bit of signposting there. The Safer Recruitment Consortium, it's worth looking at their website. They've got lots of information. They are education based, and they are the ones who have worked with the NSPCC to do the Safer Recruitment training, the main programme nationally that we signpost to. Also, they have on there a better hiring toolkit for education settings, which is written with schools in mind, but there are some useful bits and pieces that you could take from that.
Lovely.
Thank you.
Thanks, Ray. The last few slides, and we thank you to all of you who took part in the annual provision audit. It really does support us to find where there are gaps in confidence or knowledge, or provision in some areas, particularly when we were talking about the early years strategy that I mentioned earlier. Participation was high for this feedback tool. 72 childminders responded, with most working low and holding a level 3 qualification. I'm not going to go through these because really these were our findings, but it's the actions I want to focus on particularly. So those were the key findings for childminders and the key findings summary for group provision. Again, participation is high, 89 group settings responded, could be even better. So I know, I really appreciate how busy you are, but we try and give you a time period through which you can respond, and genuinely the feedback we got back is it really doesn't take very long. Now we've got the electronic form sorted, it really doesn't take long, but the payback for us being able to target our support effectively to you is huge, and also to gather the evidence of impact of some of the work that's being done. So please, next year, let's see if we can get it even higher, but thank you everybody who did participate. So the actions that we've got from there is for childminders to strengthen inclusion for multilingual families, expand the SEND childminder network, improve the use of graduated response, strengthen understanding of funding for disadvantaged children, increase the uptake of the anti-racism statement, boost consistency of transition practices, encourage broader participation in training, improve engagement with apprenticeships and placements, increase visibility of support tools, and strengthen communication from family hubs. So work there certainly for our team and the wider North Somerset team to be supporting you in practice. And for group provision, it's improving confidence and training for supporting GRT, refugee and resettled children. So Hina Crab is going to join us in the autumn term. Certainly for the refugee element of that, increase awareness and understanding of social deprivation funding, raise visibility of graduated response, promote the anti-racism statement, that's come up again, expand awareness of briefing session recordings, strengthen communication from family hubs, support recruitment and retention, enhance EYPP engagement where low, and encourage providers to follow the EY team Facebook page just as another line of communication. So we will be doing various bits there that will inform our work, and so you'll see elements of that being coming through on the training that we're offering and information we're getting out to you. But that's, it's just to know your response is really valued. As I said, Hina Crab from the resettlement team is going to join us in the autumn, but for now we just wanted to signpost people back to the resources we have online aimed at practitioners working in early years settings which have refugee and asylum seeking families and children. So do have a look at that if that is you, or if it's something you're interested in preparing yourself for should you have any children from these groups come into your setting as one of our vulnerable groups. This is the anti-racism statement. Some people came back and said, in fact, a lot of you either were displaying it, you weren't yet, but you were about to. But there was a sizable portion of people that didn't know about it or weren't aware of it or had forgotten about it. So the idea is part of our United Front Against Racism is that you, when you are happy to display this statement, inserting your settings name in there, that in North Somerset we celebrate diversity, promote inclusion and challenge racism and all forms of prejudice. We want every child to grow up to do the same. If it's something you haven't got confidence in, we'd love you to get in touch with us to talk that through, because our ambition is to, at least 90% of our settings are sharing this as part of their induction, and it's up in their settings as a statement. Just some information from our family hubs about the parenting villages that are being postponed. So again, please do scroll through these for your area so that you are up to date with the information for your parents. So these will be on and these are the parenting villages that are running. So again, as soon as you get the slides, please do look at those and perhaps display them to support your parents. The annual safeguarding questionnaire is we are aiming for it to be sent on the 5th of June. There is an expectation from the Safeguarding Board. It's not statutory, but it's a strong expectation with our high standards across North Somerset that all providers complete the questionnaire. Again, it's really quick now, really got, you know, these slick online questionnaires now, but again, the importance of it and the information we gleaned from it is the more we get back from you, the more effective it is. So if everybody does it, we really do get a good picture about gaps in knowledge, and also, you know, where our confidence is strong. You know, we are so strong with Ofsted at the moment. It's wonderful. We want to keep that going, want to keep that momentum going. So it's a short online form, only a few minutes. It's shorter again than the annual provision audit. If you have more than one setting, please complete a separate questionnaire for each, as the answers may not be the same, especially around staff confidence. They're really valuable to us. And also we're going to send out an optional safeguarding audit that we've drafted in response to, you know, to you asking us that some people like to do that internal audit. That's just for your own practice, not for us. But again, it might support with any Ofsted conversations, or more importantly, will support with your safeguarding provision. We are going to be sending out the transfer document. There's very few changes this year. So this is the email you're all going to receive. The deadline for submission to schools is the 19th of June. And the recommended completion period is between the 1st of June and the 12th of June. But this is just really a heads up. We're going to be sending that email out on the 6th of May, along with the transfer document for this year. CPD, Rhea, you're just going to go through these slides until we get to the leadership one.
Yeah, I'm not going to read them through, just really to highlight that for those of you that may have been considering coming or have booked on the face-to-face early years best practice network at the Hive on the 14th of May. That session's been cancelled again due to a lack of bookings for a face-to-face session. We need to make sure we've got enough people. So they are just now the 2 online sessions. You'll see all of these when you see the PowerPoints. These are all hyperlinks, so you can click on these and it should take you straight to the booking page if you click on the blue on the left. Next slide, Gail. And then you'll see I've put a big star by the ERIC training. So there you go. You've got the link again for that one. And I think just the other one to highlight, the safeguarding workshops in June is with the LADO. And so Ali is going to be coming to talk to us and doing managing allegations in that session. Thank you. And that's the last page there. Thank you.
Lovely. And if I can just say, the best practice networks are going to be looking at maths. So, I mean, the idea initially with the best practice was that it was targeted more at people who are on the floor rather than leaders and managers, but that's entirely up to you. Often we do have leaders and managers coming and then disseminated the information, but it's about very practical, everyday maths in our settings, and we have input there from peers, as we have done before. We've had input from our local authority nurseries and from other local nurseries and childminders, and we've got the same this time, so them sharing their high quality maths provision to give you some ideas and tips to further strengthen what you're offering in that area of the curriculum. We know that we have had a gap in our leadership training for some time, and we've been really looking at how we can deliver that in a really authentic way. And we've recently met back up with Tia Claridge, who a number of you will know from Station House and Lake House nurseries, but also has 20 years experience in early year settings in North Somerset. Tia has recently done her masters and is now working for Families First nursery chain, of which Lake House and Station House are a part, but she's has developed a wonderful leadership programme which she has run out across over 100 nurseries through that chain, has had wonderful feedback, and so we're hoping to engage with Tia. We are engaging with Tia to develop 3 sessions that we'd like to offer in September, October and November, dates to be decided, targeted at leadership, people currently in leadership. 3 sessions. Each session is going to be a day on a Friday from 9:30 to 2:30. Face-to-face, a venue yet to be decided, and we are going to be charging for that only £40. So it's £40 for a 5-hour session, so it'll be £120 across the 3 sessions. But we just know that with the focus on leadership through the Ofsted toolkit, we know that leadership really matters, and we feel that we have been there's been something offered through our own training, but only short workshops. So we really want to offer this to you, but we'd like, before we book in dates and go forward with it, we'd like to use this session just to know if you are a leader and that sounds just as an outline, something you might be interested in, could you just pop that in the chat so we can start to see whether we're way off mark or whether that might be something that would be well received. And I say you can, go into more detail about what those sessions are like, but definitely it's a real high quality, and the impact that it's made on that leadership and has been phenomenal, which is why we wanted to engage with this existing programme. And finally, we have our early years conference this year. We thought you just deserved to have a really high quality speaker who is renowned both nationally and internationally. So we have been really chuffed to get Professor Julie Fisher. A number of you will know that she wrote the book Interfering or Interacting. She is very much about child-centered practice, and although she supports the some of the evidence-based intervention programme, her presentation is all going to be about interactions with children, how we engage at that first level with our relationships with children and the difference that makes on their life outcomes. So she's going to be coming to Weston-super-Mare on Saturday the 3rd of October. It's just a morning, so a 9:30 start till 12. Julie's the only speaker. We just wanted to have a real focus with her, and then there will be some time afterwards for networking with your colleagues. There'll be coffees and pastries and wonderful things to come to. So at the Winter Gardens, we wanted to give you a lovely venue. So again, that's just a heads up. Pop that date in your diary, and we will be advertising that and sending out more information about that as soon as possible. So that's all. Apologies, we've overrun. We tried just to pack too much in today, but thank you for staying, those that have been able to. The evaluation form is now is there. You need to do that through iLearn. It really matters. We need to know that these are meeting your requirements. So two things then. The PowerPoint can be accessed. It would be put up as soon as we can after this session. Please complete the evaluation, and please do pop in chat any of your feedback about that potential leadership training, so we can see if it may be a popular one to run. But thank you for your time. Hope you enjoy the rest of the day. I managed to get a little bit of sunshine if you can. Thanks to all the presenters as well.